Here in Los Angeles, the investigation into Michael Jackson's death has taken a dramatic turn. There are reports that police found Diprovan, a powerful anesthetic, in Michael Jackson's house.
When Michael Jackson passed away on June 25th, 2009, many people believed that years of intense performances, physical strain, and relentless pressure had finally taken their toll on the king of pop.
We're learning details of the autopsy report on Michael Jackson, and it's revealing surprising new information about the superstar.
When the autopsy results were released, they revealed a story few people expected. Beneath the tattoos, scars, and years of cosmetic procedures, medical examiners discovered that Michael Jackson's body was in surprisingly good condition. At 50 years old, many of his vital organs were found to be remarkably healthy, challenging the widespread belief that his physical health had completely deteriorated.
So you have a good body mass index, you're not obese, you don't have a lot of fat in your body.
The report that followed documented distinct music findings, each revealing a piece of a far more complicated picture than the tabloids had ever printed.
On February 8, 2010, Dr. Conrad Murray is officially charged.
The healthy heart. Coroners might have expected to find a heart weakened by years of illness. Instead, Michael Jackson's autopsy revealed that his heart was remarkably healthy for a 50-year-old man. His coronary arteries showed no significant plaque buildup, and his heart weighed approximately 290 grams, within the normal range for a man of his size. The valves were intact, and the heart muscle appeared healthy. At roughly 136 pounds and around 5 feet 9 inches tall, Jackson was not as severely underweight as some tabloid reports had suggested. Toxicology also found no evidence of illegal drugs in his system. This finding became important during the investigation into Dr. Conrad Murray. The autopsy provided little evidence of a serious underlying heart condition that could independently explain Jackson's death. Instead, the evidence pointed investigators toward the medications administered during his final hours. The mysterious bedroom image. One image circulating after Jackson's death showed him lying motionless on a bed, wearing a white tank top and black pants. A person appearing to be a medical examiner can be seen nearby, seemingly documenting the scene. The dark, cluttered room and Jackson's closed eyes create an unsettling impression, making the photograph look like something from an official investigation. However, the true origin and authenticity of the image have remained unclear. So what was the image actually showing? That question has continued to fuel speculation. The chronically inflamed lungs. One of the more significant findings in the autopsy involved Jackson's lungs. Examiners found chronic inflammation and reduced lung capacity, suggesting that he may have been living with the condition for years. However, the medical examiner made an important distinction. The lung condition was not severe enough to be considered a cause or contributing factor in his death. The findings suggested a chronic respiratory problem rather than a sudden fatal event. Doctors who later reviewed the case generally agreed that the condition could have affected Jackson's breathing and potentially worsen over time, but it did not explain why he died that day. Arthritis and age-related changes. Not every discovery in the autopsy was dramatic. Jackson had arthritis in his lower spine and several fingers, along with mild plaque buildup in the arteries of his legs. These findings were considered relatively ordinary for someone approaching 50. Imaging showed osteoarthritis in his spine and hands, consistent with normal wear and tear rather than a major injury or life-threatening disease. In other words, much of what examiners found reflected the ordinary physical aging of the body. Confirmation of vitiligo. Examiners documented areas of depigmented skin across his chest, abdomen, face, arms, and legs. Patches of pale skin appeared alongside areas where pigmentation remained. The pattern was consistent with the condition Jackson had publicly described since the early 1990s. The diagnosis was included in the official autopsy findings, providing medical documentation of a condition that had been heavily debated by the public for years. Sparse hair and the wig. The autopsy also revealed what was beneath Jackson's famous hairstyles. Examiners found sparse natural hair and noticeable frontal balding. A wig had to be removed before the examination could continue. Beneath it, examiners documented scarring on the scalp associated with the serious burns Jackson suffered during the 1984 Pepsi commercial accident. The hair Jackson presented to the public was therefore very different from his natural hair. His own hair was reportedly kept short so that it could lie flat beneath his wigs, allowing the elaborate hairstyles seen during performances and public appearances to maintain their distinctive appearance. The scalp tattoo. Jackson's efforts to maintain his appearance extended beyond wearing wigs. The autopsy report described dark pigmentation across the front portion of his scalp, extending roughly from ear to ear. The area appeared to have been tattooed to reduce the contrast between his scalp and the dark hairpiece. The cosmetic procedure helped create a more natural-looking hairline. It was another small detail that revealed the extensive preparation behind Jackson's public image. Facial tattoos. The cosmetic work did not stop at his scalp. The autopsy documented pigmentation tattoos on Jackson's lips and eyebrows, as well as dark tattooing around his eyes. These procedures helped maintain a consistent appearance without relying entirely on daily makeup. While most fans would never have noticed these details from a distance, the medical examination documented them clearly. Surgical scars. Jackson's body also carried evidence of decades of medical and cosmetic procedures. Examiners identified scars behind both ears, around the nose, on the neck, shoulder, wrists, and knee. Taken together, the scars provided a physical record of procedures Jackson had undergone throughout his life. None appeared to be recent injuries connected to his death. Instead, they reflected years of surgeries and medical interventions. Injection marks. Perhaps more revealing were the numerous puncture marks found across Jackson's body. Examiners documented injection sites on his arms, hips, thighs, shoulders, and ankles. Some appeared relatively recent, while others had already healed. There were also puncture marks consistent with intravenous access around the elbows and hands. The widespread distribution suggested that injections and medical treatments had become a recurring part of Jackson's life. These marks did not, by themselves, establish what ultimately killed him. Instead, they provided insight into the extent of medical intervention he had received in the period before his death. The stomach contents. When examiners examined Jackson's stomach, they found approximately 70 grams of dark fluid but no pills, capsules, or significant solid material. Toxicology detected a small amount of propofol in the stomach contents, but experts determined that oral ingestion was not responsible for a lethal dose because propofol has extremely low oral bioavailability. During Dr. Conrad Murray's trial, the medical examiner testified that he had specifically looked for pill fragments, but found none. The dark stomach fluid was also thought possibly to have been fruit juice. Toxicology separately identified lorazepam, another sedative, in Jackson's system. Taken together, the autopsy findings painted a complicated picture. Jackson had several chronic and cosmetic medical conditions, but the major findings did not point to a hidden disease that suddenly killed him. The evidence instead focused attention on the powerful medications administered during his final hours and the medical decisions surrounding them. The empty stomach and drug delivery. The absence of pills in Jackson's stomach became another important detail in the forensic investigation. His stomach contained only a small amount of dark fluid, with no capsules or tablets that could explain the drugs detected in his system. Because medications such as propofol were present in his blood rather than appearing as evidence of normal digestion, investigators focused heavily on injection as the method of administration. It may seem like a minor detail, but it became an important part of the forensic argument during the criminal case that followed. The normal kidneys. Organ by organ, the autopsy continued to reveal relatively little evidence of serious chronic disease. Jackson's right kidney weighed approximately 140 grams, while his left weighed around 130 grams. Both had smooth cortical surfaces without significant scarring, cysts, or kidney stones. There was no major evidence of kidney disease, organ damage, or prolonged renal stress. Doctors who later reviewed the findings noted that his kidneys appeared generally healthy. The urinary bladder contained only a small amount of clear urine and showed no obvious signs of acute infection. The kidneys themselves were within the expected size and weight range for Jackson's build. These findings helped rule out chronic kidney disease or kidney failure as an explanation for his death. The overall picture was striking. There was little evidence that his organs were simply failing on their own. Instead, The investigation centered on what had been administered to him in the final hours of his life. The normal liver. Jackson's liver told much the same story. The organ weighed approximately 1,480 grams and was described as reddish-brown, soft, and covered by a thin capsule. Its cut surface appeared smooth and structurally intact. The gallbladder contained normal bile and showed no stones. Examiners found no significant scarring or cirrhosis. For someone whose health and medication use had been the subject of intense public speculation, the condition of his liver was notable. Along with a relatively healthy heart and kidneys, it supported the conclusion that Jackson did not have widespread organ failure or severe chronic disease that would independently explain his death. The enlarged prostate. At the age of 50, Jackson also had an enlarged prostate, a condition commonly associated with aging in men. The condition may have contributed to urinary difficulties, although it was not considered life-threatening. Some medications Jackson was taking may also have affected his symptoms. Compared with the more dramatic findings in the autopsy, an enlarged prostate was an ordinary medical issue. It did not cause or contribute to his death. In fact, the findings served as a reminder that beneath the extraordinary circumstances surrounding Jackson's life and death, some parts of his medical history were surprisingly routine. The bruised chest and fractured ribs. At first, bruising across Jackson's chest and several fractured ribs might sound like evidence of serious trauma. But the circumstances surrounding those injuries tell a very different story. The fractures and bruising were attributed to prolonged CPR and chest compressions performed by emergency responders and medical personnel attempting to revive him. Jackson received aggressive resuscitation efforts at his home and later at UCLA Medical Center. Medical teams continued working to restore his heartbeat for an extended period. Chest compressions performed with enough force to circulate blood through an unresponsive patient can fracture ribs and damage the sternum. These injuries are an unfortunate but recognized consequence of intensive CPR, particularly when resuscitation continues for a prolonged period. Doctors also attempted additional emergency measures when conventional resuscitation failed, including the use of an intra-aortic balloon pump in an effort to restore circulation. Ultimately, those efforts were unsuccessful. Importantly, the fractures and bruising were not considered evidence of an assault or injuries that occurred before the emergency response. They were consistent with the desperate attempts made by paramedics and hospital staff to save Jackson's life. In that sense, the injuries were not clues to what killed him. They were evidence of how hard medical teams fought to keep him alive. The knee puncture marks. Separate from the injection marks found across Jackson's arms and torso, examiners also documented puncture wounds around his knees. These findings were consistent with his history of knee problems and treatment for recurring joint pain. The autopsy also showed degenerative changes around the knees, including cartilage wear around the patella. For someone who spent decades performing demanding dance routines, the condition of his joints provided another indication of the physical toll his career had taken. Unlike the injection sites associated with medications administered elsewhere on his body, the knee marks appeared more consistent with orthopedic treatment. The knee problems were not considered a cause or a contributing factor in Jackson's death. Instead, they added another detail to the picture of a performer whose body had endured years of intense physical activity. The bedroom scene. The bedroom investigators entered at Jackson's rented mansion looked less like a normal private bedroom and more like a makeshift medical treatment area. Prescription medications were found on nearby tables, including drugs used to treat anxiety, insomnia, and other conditions. Investigators also recovered multiple vials of propofol from the residence. The collection of medical equipment suggested that Jackson's treatment had extended far beyond what would normally be found in a household medicine cabinet. For investigators, the scene became an important piece of evidence because it helped establish the circumstances surrounding the medical care Jackson was receiving in the hours before his death. The toxicology results. Toxicology testing identified several prescription medications in Jackson's system. The most significant were propofol and lorazepam, with other medications also detected, including midazolam, diazepam, lidocaine, and ephedrine. A syringe recovered near the bed contained residues of propofol and lidocaine. Importantly, toxicology did not identify illegal recreational drugs as the explanation for Jackson's death. The concentration of propofol detected in his femoral blood was approximately 3.2 micrograms per milliliter. Experts considered that concentration consistent with a level capable of producing profound anesthesia rather than ordinary treatment for insomnia. The combination of multiple sedatives was also significant because drugs that depress the central nervous system can have additive effects, increasing the danger of respiratory depression and cardiovascular complications. The toxicology findings ultimately became one of the central pieces of scientific evidence in the criminal case against Dr. Conrad Murray. The fatal propofol concentration. The amount of propofol detected in Jackson's blood was far more significant than simply finding the drug in his system. Propofol is a powerful intravenous anesthetic normally administered in controlled medical environments. Its use requires appropriate monitoring because excessive sedation can suppress breathing and compromise circulation. Jackson, however, was receiving the drug in a private residence while being treated for insomnia. Murray told investigators that he had administered relatively small doses of propofol during the night. Prosecutors questioned whether the amount and circumstances of administration had been accurately described. Regardless of the precise amount administered at any individual moment, the toxicology results demonstrated that Jackson had a substantial concentration of propofol in his system when he died. That finding became a cornerstone of the prosecution's case. The homicide ruling. The Los Angeles County coroner ultimately classified Jackson's death as a homicide. The official cause of death was listed as acute propofol intoxication, with the effects of benzodiazepines identified as a contributing factor. The homicide classification did not mean that investigators had determined that Jackson was intentionally murdered. In forensic terminology, a homicide classification means that another person's actions or involvement contributed to the death. That distinction became crucial in the case against Dr. Conrad Murray, Jackson's personal physician. Prosecutors argued that Murray's actions and medical decisions created the circumstances that led to Jackson's fatal overdose. The coroner's findings provided the medical foundation for the criminal proceedings that followed. Murray was ultimately prosecuted for involuntary manslaughter rather than a charge requiring proof of intentional killing. The missing pills in the stomach. In the immediate aftermath of Jackson's death, some media reports claimed that his stomach contained partially dissolved pills, creating the impression that he had swallowed a large quantity of medication before dying. The autopsy did not support that account. During the 2011 trial, Murray's defense suggested that Jackson might have secretly taken additional medication while Murray was out of the room. But forensic evidence undermined that theory. Examiners found no significant collection of pills, capsules, or pill fragments in Jackson's stomach. Instead, they found only a relatively small amount of dark fluid. Experts also explained that propofol is not effectively absorbed when swallowed, making oral ingestion an implausible explanation for the fatal concentration found in Jackson's bloodstream. The medical examiner testified that he had specifically searched for evidence of pills and found none. As the trial progressed, the defense moved away from the theory that Jackson had swallowed the fatal dose. What the autopsy ultimately showed. When all of the findings are considered together, the autopsy presented a striking picture. Jackson had chronic medical issues, including lung inflammation, arthritis, an enlarged prostate, and degenerative changes in his joints. He also had extensive surgical scars and evidence of long-term cosmetic and medical treatment. But the major organs examined by the pathologists, including his heart, kidneys, and liver, did not show the kind of severe disease that would independently explain his sudden death. The decisive evidence came from the toxicology results and the circumstances surrounding the administration of powerful sedative medications. The official conclusion was that Michael Jackson died from acute propofol intoxication, with benzodiazepine effects contributing to the fatal event. Rather than revealing a body overwhelmed by a hidden terminal illness, the autopsy documented a man whose major organs were largely functional but who had been exposed to a dangerous combination of powerful medications under circumstances that ultimately proved fatal. The forensic record, therefore, became central to understanding not only how Jackson died, but also why the investigation focused so heavily on the medical care he received during his final hours.